music here. That could be the right music. All right, let's use that music. I like that. Start over again. Hey, welcome back. It's time for another episode of the OC Spotlight. The one show that takes a look at the most incredible people doing the most amazing things right here in your own backyard. And today, well, guys, you want to listen up on this one because this is something that, I don't know if it just affects guys, but it's certainly on our minds as we get older here. We're talking about a serious subject, but a positive, unique way to handle that serious subject. We're talking about prostate cancer. Yes, don't turn off your tunes yet here. We got some hope for you here if you've experienced any of that or the fear of it or are wondering about how to treat it. We've got some experts in the house today here. Starting with Dr. Robert Pugash from the Pacific Coast Urology Center right here in Orange County. Welcome, sir.
Thank you. Thanks for having me.
Why do I always have to call doctor sir? See, I'm dating myself here. A doctor is somebody we look up to, we respect, and you certainly have achieved a lot. Tell us about the Pacific Coast Urology Center overall before we get into the specifics of what you're doing there.
Well, Pacific Coast Urology Medical Center is over 30 years old. I've been practicing urology for about 34 years now, and several years ago we also formed an organization called Western States HIFU to help guys deal with prostate cancer, and it is focused on minimally invasive or non-invasive ways of treating urological conditions, so we avoid large surgical procedures, we avoid the side effects and complications of many of the older therapies, and allow guys to have treatments that really have minimal interference with normal life and getting back to normal activities quickly.
I can't think of any surgery I would fear more than prostate cancer here. My dad, my late father, suffered from it. So many men do. It's something that we're more likely to experience the older we get. I'm in my 60s here, and my doctor's always saying, oh, we better test for that every year here.
It's good that your doctor says that. You're right, it does happen as we get older, but interestingly, the youngest recorded case right now is in someone who is 33 years old. So we seem to be diagnosing it at earlier ages. The question is that because we're better at diagnosis, or is there something in the environment that is causing that? And I think it's probably a bit of both. Okay,
so when it appears, the normal procedure is what? You go in and operate on the most sensitive part of a man's body here.
We do, but we have to back up a little bit. The first issue is how to find out if you do have prostate cancer.
Okay.
And September is actually National Prostate Cancer Awareness Month. It has been that for decades. And it's a way to encourage guys to come in and have the appropriate testing to see if they do have prostate cancer. And there's two things that need to be done. One is a blood test called a PSA, or prostate-specific antigen. And it's an imperfect test. If it's not normal, doesn't mean someone has cancer, but it means there's a possibility. But there are other causes that make it abnormal. And in addition, we need to do an examination of the prostate called a digital rectal exam, which most guys shy away from. But it takes,
just the name of it scares me here.
Well, at least it's digital, not analog. But it takes about 5 seconds to do, and the reason we want to do that is many prostate cancers have normal PSA blood tests, so we could miss them if we didn't do an examination.
Because that's normally what they do. What's PSA stand for? I don't even remember, but somehow you got to get a PSA test, and if it's up above a certain level, you're in risk of having prostate cancer.
Exactly. Actually, it's not a very good name. Prostate-specific antigen, number one, it's not specific to the prostate, and two, it's not an antigen. Otherwise, it's a great name. But nevertheless, it's the best that we have right now, and it does allow us to diagnose a lot of men with prostate cancers at an early stage when they're easily treatable and curable.
So, again, the normal process is what? You go in, I hate to even say the word because everybody will giggle, but it's you take your penis and you stick something in it there and clean it out. My dad crudely described it as a rim job or something, or he went in there and just cleaned it all out here. It was horrible.
Well, what you're describing is the old Roto-Rooter procedure.
Yes, right.
And that's actually for something else. That's for the benign growth of prostates that cause us to wake up at night, to urinate and give us a slow stream and maybe leak some urine.
Right.
This is different. This is prostate cancer, and actually one of the problems of prostate cancer, one of the challenges, is that it doesn't give us any of the symptoms that we see with traditional benign prostate growth. So it's a silent cancer, and oftentimes...
So you're not experiencing, typically they say suddenly there's something blocking the flow. You can't pee very well here. It's hard to go at night here.
Exactly. And so because of that, that's why screening is so important, because if we wait until there are symptoms, which oftentimes is bone pain because it's spread to the bones or other structures, it's too late.
And too late means you die.
It means that you can't be cured from cancer, and in the United States this year, we're going to lose about 32,000 men to prostate cancer death.
See, I find it amazing. It's similar to what my wife always talks about with breast cancer. It is something that is easily, not all cancers are that, but there are some that you can detect and get at early. And if you get to them early enough, the chances of survival are high, right? But we don't do it. Is it just because we're afraid to know? I kind of fall into that category. If I don't know, I can't be sick.
I think guys are a lot more reluctant to find out if something is wrong than women. I think women are much more proactive when it comes to health issues. A lot of the guys that I see in my office are there because women have said to them, I want you to go in and get screened.
Yeah, right. And guys are tough, and there's nothing wrong with me. I'm okay, and I'm just going to gut it out. And so I don't know if it's the little kid in us that doesn't want to know, or the big adult that thinks we're tough and strong and brave and don't want to do it. Or is it the fear of having to do this? I mean, you're going to have to operate on something that I don't really want anybody to touch and operate on here. That sounds horrible to me. So the idea that you guys have come up with is what? You've come up with this, you call it HIFU, which sounds like a Japanese acronym, but it really stands for high intensity focused ultrasound. Ultrasound you're using does it dissolve it? Does it break it up? And how does this work?
Well, it's interesting that you said it sounds like a Japanese acronym, because the urologist who first taught us that we could use HIFU for prostate cancer was Professor Uchida in Tokyo.
See, I knew that.
He's a very wise individual, because HIFU was actually invented for benign prostate growth, but he taught us back in 1999.
Benign meaning it's not growing anymore. Is that what? Define those terms. I know they're always saying benign, or I forgot the other term that's growing.
So non-cancerous is probably a good definition of benign.
Okay.
But it is a growth. So he taught us that we could use this for prostate cancer. And one of the challenges with prostate cancer is, number one, is you just alluded to, getting guys in to be tested because of concerns about the effects of treatment. And two, the effectiveness of the treatment. So the traditional ways of dealing with prostate cancer have been either radical surgery, and radical is always a scary word.
Yeah, right.
Or various forms of radiation. And with radical surgery, at a minimum, guys have a 35% chance of permanent urine leakage afterwards.
Oh, my God. And
So
how about the other one? Maybe I'm being too scary here or something, but guys are so frightened of erectile dysfunction and not being able to be, this true guy. Does that affect any of this too? I mean, are we damaging your gear? I don't know how to describe this in a polite way here.
Gear is an interesting word, but we'll go with that. So let's say there's
I'm an automotive guy. I got to think of everything as gears and functions.
well, let's say there's a 50 to 90% chance of gear malfunction afterwards.
Yeah.
And that's permanent. That's the problem. So we may joke about it a little bit, but stop to think about facing a treatment that, yes, could cure your cancer, but for the next 20, 30, 40 years, you're wearing pads or diapers and you can't have any intimacy.
Yeah.
That's huge, which has caused a lot of guys to look for alternatives.
Yes.
The more traditional ones being some form of radiation. And radiation comes in many different forms, from protons to seeds, to something called a gamma knife or cyber knife. There's about 7 different types.
And the thing, I'll stop you there for a second, because somebody described this once and I thought it was an effective way. And I hope this doesn't offend you because you're a doctor. But it seems like we're using radiation of some sort to treat most cancers, to try and what does it do? It attacks them, it breaks them down somehow, or whatever. It destroys them in some sense. But it's like using a sledgehammer to get out a sliver. I mean, it's not very focused. You're trying to get something. You're over radiating the section of the body, and that's what makes people so sick.
In large measure, you're spot on. Certainly in the pelvis, where prostate cancers live, because of scatter radiation and because of the fairly wide field that we treat, we can damage other structures. And it's hard to get enough radiation directly into the prostate to give a permanent cure. So the recurrence rates with radiation can be quite significant. And the problem is if radiation comes back, prostate cancer comes back after radiation, we don't have any good answers. Jerry Brown, our last governor, was a good example of that.
Yeah.
Jerry's prostate cancer was diagnosed in 2012. 5 years later, his PSA was going up. He had biopsies showing more cancer, and he said at the time that he was going to have more radiation, but that wasn't true because you can't have more radiation. We give you the maximum dose. So if you have surgery after radiation, you have no control of urination. It just pours out and you're in diapers all day long.
Oh, my goodness, yeah.
So you end up going on a medication that takes away all of your testosterone. Imagine waking up every morning without testosterone. You don't want to get out of bed.
No, exactly.
There's no energy. There's no focus. So radiation that fails is a terrible situation, which is why treatments like HIFU are such a wonderful alternative now.
Okay, so you scared me about the traditional way. Give me some hope for this new technology. Is this something that you guys are pioneering? Is this something that you do unique here in Orange County, or has this become an accepted alternative to, a widespread alternative to traditional invasive surgery?
Going back to 1999, when Professor Uchida said we could use this for prostate cancer, little by little it's been accepted throughout the world. And over the decades that ensued, dozens and dozens and dozens of countries adopted the treatment of HIFU. We were kind of late to the game in the United States for a variety of reasons. Our FDA took a while to approve it, and it wasn't until late 2015 when they said it was okay. And
we were recently, okay.
We were at that time, I believe, the 46th country to adopt it.
Wow.
So we
seem to lag in lots of things. I don't know specifically, but they're always saying there are alternatives available in other countries, and people sometimes go to, I don't know, Canada, Mexico, someplace or whatever, to seek treatments that we still haven't accepted here that do work and are accepted in other places.
And indeed, that's exactly what I did, and not a lot, but several other urologists did. So on a monthly basis, we would literally leave the country and travel to Canada, Mexico, the Caribbean, Europe, and treat our patients. They would fly with us. We would treat them and then come back with them because we were not allowed to do the procedure here. And so I started doing this almost 15 years ago and have amassed a fair amount of experience now. And it's been a lot of time spent working with the folks, the engineers who make this equipment to help them improve upon it and get it to the point where we have a pretty amazing technology today.
All right. Well, your partner in this process here has been silently sitting here and listening to all this. Let's welcome him in for a moment. Ross, and is it Balson? I forgot to ask.
Balson.
Yeah. Balson, okay.
Yep.
Say it real quickly.
Balson. Yep.
You do what? You're you're on the HIFU part of it. You guys somehow produce the equipment to do this?
We actually bought it from the manufacturer. We own it in conjunction with partners, and we provide it for our physicians to be able to use to treat patients.
And is there anybody else in Orange County doing this, or are you the lone pilgrim in this process here? I mean, for the doctor's sense, are there lots of doctors doing this now, or is this still pretty unique to what you're doing?
I think it's safe to say we do 99% of the HIFU.
Okay. Now, let's talk about HIFU, because I like the idea, high intensity, but focused, because that's what I fear about most cancer treatments. It's a sledgehammer. You're going to not just go after the small section where this cancer growth is happening, but you're going to radiate everything, and I'm going to get sick and damage and problems. Talk about the high-intensity focused ultrasound that you use. What is it and how does it work?
Okay, so instead of getting the scatter that you get with radiation, and a good example of that is if you ever look at a drop of water as it hits a puddle, you'll see the radiating droplets. That doesn't happen with HIFU. HIFU takes an energy beam, initially shaped like a triangle. The base of the triangle has a lot of diffuse energy, and the phenomenal software and transducers that we have will then focus that to the top of a triangle, and that's where the heat is produced. If you think of what you might have done as a child, where you're outside on a sunny day with a magnifying glass
That's
and a leaf.
exactly what I was going to suggest. You're taking a magnifying glass, you're taking the light, and you're focusing into this beam, and you're burning something, a leaf or whatever.
Exactly, but you're not burning anything in between. And if you put your hand under the magnifying glass, it wouldn't get hot.
That's true. Yeah, I've never thought about that. Yeah, exactly. Right.
Well, this does the same thing. So it passes harmlessly through tissues until it gets to the area that you're aiming for.
Because it's finally when it's focused, it's that end of the beam that gets hot. It's not the accumulated top of the funnel here.
Exactly, and the top of that triangle is approximately the size of a grain of rice. We can actually move that grain of rice within fractions of millimeters. That's how precise this is.
Wow.
And so
I'm not over radiating. I'm not over burning. I'm not over attacking the rest of the body here.
You're treating exactly what you are focused on and nothing more. Now, that can be the entire prostate if there's a lot of cancer throughout the prostate based on biopsy results or an MRI. That can be half of a prostate, a quarter of a prostate, the size of a pea area within
How big
the prostate.
is the prostate? I don't even know.
It varies. When we're at age 25.
It's like, what, a gland or something?
Yeah,
Or-
it's the prostate gland. Really what it is it's for reproduction. It's a common channel for urine and for semen.
Okay.
Once we're past our reproductive years, it has no particular function. And at age 25, it's roughly the size of a walnut. And little by little, it starts growing, and it can grow 10%, 50%. It can grow to the size of a grapefruit in some people.
Oh, my goodness. Yikes. Okay, so does it burn it? Does it dissolve it? Does it break it up? What does it do with that focused end of the beam here?
Every 3-second burst of ultrasound energy will raise the target temperature to somewhere between 90 and 100 degrees centigrade. So we are superheating the tissue, and there are no cells of any type, be they cancer cells or benign cells, that can withstand and survive that kind of heat.
So you're breaking it down. You're dissolving it. You're destroying it. It disappears. It breaks
Well,
up.
we're destroying it, but it doesn't disappear. So after each 3-second burst, we have an area the size of a grain of rice that's now dead, that there's no viable tissue in there.
Okay.
Little by little, that goes away. Either when somebody urinates, little pieces can come out, or the lymphatic system will digest that and excrete it. And at the end, the area that we've treated is just a cavity. It's gone.
I got to think about that image because that just seems so amazing and so obvious, as opposed to going in with a knife and trying to cut it out, or going in with dangerous radiation and trying to kill it that way. It seems so much more logical to focus your energy, focus your beam on a small part. And you're doing this through the body. So am I correct? There's no incision, which means there's no blood loss?
Zero. And there is no incision. So we're able now to move forward with technology. In the old days when surgery was all that we had, that's what we did. We advanced from large open operations to robotic surgery, but it was still surgery. It still is surgery.
Right.
We've gone through all these different types of radiation, but what you've seen is because of the recurrence rates with radiation, because of the side effects of surgery, guys have reluctantly said, I don't really want to know if I have prostate cancer, and many have said, if I do have it, I don't want the treatment.
Yeah. No, that sounds unbelievable, but I know, guys, I might fall into that category myself here. The treatment sounds, even though you're going to die, I don't know why, it just seems so horrible, so awful, so many side effects, so many downsides that you just can't deal with it.
I don't know any urologist, myself included, who do not have patients whose cancer we cured 20 years ago, but they've hated us ever since because of what we've done to their lifestyle.
Yeah, right.
Now with HIFU, that changes. Now you have something that allows someone to have their cancer treated, cured, and they move on with the rest of their life. And my family is a good example of that. I had a very close family member 12 years ago with prostate cancer who had HIFU. 12 years later, he's cancer-free and everything works. And I followed in his footsteps. 2.5 years ago, when my prostate cancer was diagnosed, and I was sure I was going to get it because a family member had had it.
Yeah, right.
So my risk was higher. When my cancer was diagnosed, I had my HIFU treatment. The day after treatment, I was on an airplane flying home. The following day, my wife and I just took it easy at home. The next day, we were on a plane to the East Coast for a family event. No pain, no downtime.
Because there's no incision. This incision, as we get older, is what's hard to recover from here.
Sure is.
Okay, so you went through this yourself. What did your friends say in the industry? Come on, the other people who follow your profession here.
Well, one of the unfortunate things some of them said was, gee, maybe I should be tested for prostate cancer, because docs think we're immune from things sometimes.
Yeah, right.
So,
You're Superman.
yeah, so some of them fortunately did get tested. Some of them I know had radical surgery and had the side effects of surgery. And there is another physician who also works with HIFU Prostate Services who did what I did. We're a part of a group of docs who have had cancer and had HIFU treatment for it because we believe in the technology and know that it works.
So why buy the technology? Was it because I'm sure there was an economic opportunity here, you can sell it to others, or was it something that you wanted to perfect and make even better? Or you couldn't get access to the equipment, so we got to do it ourselves? Well, what led you into producing this other company here, which is HIFU Prostate Services, the company that actually makes the equipment?
Actually, HIFU Prostate Services is a company that purchases machines from the manufacturer,
Okay.
and then they set up individual centers throughout the country. They're the largest provider of HIFU services, I think, in the world right now.
So you're like a distributor of the equipment, or
I'll let Ross answer that.
I say more of a service provider than a distributor. A distributor is actually selling the product on, and we're actually owning the equipment and letting people rent and use it.
so they lease it from you? Because I'm sure
Correct.
it's not cheap, all these
No, the
pieces of
machines.
equipment.
Yeah, the machines are quite expensive, and that made it cost prohibitive for people to buy into them. And so, nobody wants to pay for a big expensive piece of equipment on their own typically. And so, we found
and
we partnered
maintain it
with
and
them.
train them
Correct.
and all the other stuff.
Yes, we provide all the the technical services behind it and the financial services behind it that go along with running a piece of equipment and running a small business. Each one of these little pieces of equipment is basically its own business unit.
Give me a rough idea what they cost, ballpark here,
Ballpark, you're looking about $500,000.
Oh, for one little piece of equipment.
Yeah.
And how big is
And
it? I don't know what it looks like. Is it?
It's it's the size of I would say it's the size of a small refrigerator turned on its side.
Okay,
It's,
that's
it's
pretty
big.
Yeah,
It's
right.
big. It weighs about 300 pounds. It's not like it's something you could throw on your.
And it has some sort of
hatchback.
mechanical arm. I'm trying to picture what it looks like.
Yeah, there's actually a couple pieces involved. There's the big computer system, which is a giant box with a keyboard and a screen attached to it, and then the actual arm itself is attached to the surgical bed, and that is sort of a robotically controlled piece that's in contact with the patient, and that's where the transducer is that the sound waves come out of. And
no
provide
pain,
therapy.
no problems. This isn't have any other side effects or symptoms that we should be aware of here?
At this point in time, the answer is no. In the early years, we had all kinds of issues, and we worked through those, and as the technology got better and better, we saw patients having experiences like I had. And so when you look at a surgical procedure and you say that the minimum risk of leakage is 35%, with a HIFU procedure, it's between 1 and 3%.
Wow.
When you say that the chance of erectile dysfunction after surgery is 50 to 90%,
50 to 90%. Okay, another reason everybody's afraid to do this. But under your process,
it's 1 to 5%. And so the average
Incredible.
person walks away without cancer, dry, potent, and moves on to the next chapter of their life. You asked before about why I got involved with this. Pacific Coast Urology, when I founded it, was founded on the concept of minimally invasive treatments for urological conditions. I started years ago doing a freezing procedure called cryoablation for prostate
I've heard
cancer.
that. I was going to mention that one, yeah.
And in its time, it was a good procedure. We still do those occasionally. But like most things, you have to kind of look at what's available and say, we've evolved from freezing, we've evolved from radiation, we've evolved from surgery into something now that we can offer patients, and so that they won't be afraid of having a diagnosis made, and equally or more importantly, won't be afraid of having a treatment now.
Yeah, exactly. And again, I just focus on the word focused, because even freezing or radiation seems like you're just treating an entire region to get at one specific small spot. Whereas with this, it sounds like, if to use that magnifying analogy here, you're magnifying a beam of light on a very specific tiny part that just seems like so much more logical. You're targeting the area in a much more focused way.
You are, and that also raises another interesting issue with HIFU that's not applicable right now, but there are literally 101 proposed uses for HIFU now.
What? Really? For other things they can treat or attack or something here?
Yeah, there are clinical trials underway in this country and in China for breast cancer. It's been proposed for thyroid cancer. It has been used for deep brain stimulation for patients with seizures.
Oh, wow.
Instead of having an invasive brain procedure.
Yeah,
can be
how
done
else do
from
you
the
get
outside.
at it? Right, exactly. Particularly like, don't they do that with Parkinson's and stuff here? They're trying to go in and they're actually trying to, there's some, I know Michael J. Fox talked about it a lot. He had some controversial procedure where they actually went into his brain and, I don't know, cut something, did something, but it did.
What most people have had in the past, as you're describing with him, is they've had an implantable device put into their brain.
Right.
Now, literally, and this has been done in many, many, many patients, some of whom I have met, you just aim a HIFU beam in an area, destroy that focus where the seizures are coming from, or the Parkinson's focus, and you have pretty remarkable results. So HIFU is in its infancy when you look at other areas, but it is a absolutely accepted treatment now here in Europe and so many other countries.
Are there lots of
prostate cancer.
manufacturers? Are there lots of people what you're doing, or are you pioneering this whole process? It's not because it was only approved a couple of years ago here in this country.
Right. There are two manufacturers. There's a French machine, and there is a machine made in the U.S. by Focus Surgical. Most of us here feel that the U.S. machine has superior technology, which is why we use that exclusively. And we continue to see improvements little by little as we treat more and more patients with this.
So, Ross, where do you think this goes? You've obviously bought into the program and become a partner in this thing. It's taking this equipment and getting it widespread use, overcoming the economic obstacles, making it affordable for everybody here and supporting them and teaching them. Is the community embracing them? Are they still... We always think of doctors as kind of, I'm sorry to say, kind of stuck in the whatever last technology is, you know.
You get that with, there's always going to be an early adopter side of the physician, and then you've got the rest of the people that sort of follow along later. And so we're still, I think, in our infancy at this point. It's just going to grow from here, and it's been growing from here every single year, year over year. We treat a lot of patients every single month. We've got, we're nationwide. We've got machines spread out across the country. We've got a couple here in Southern California, and it continues to grow every single year, and more physicians get involved every single year. And the nice thing about the machine is it doesn't know who's sitting down at it, whether it's Dr. Pugash or
me
or Dr. B, whoever might be the next person.
Exactly.
And it's a repeatable process. And we use doctors like Dr. Pugash who have a lot of experience to proctor the other guys because it's a repeatable process, and obviously it just takes experience, and you're dealing with years of experience. Dr. Pugash was offshore for years doing this and has a lot of experience, and so we can tap into that here locally or around the country. We have physicians actually fly in to Southern California to actually watch him provide this service to the patients, to understand, how to talk to their patients about it and provide it in their markets.
And how to use it. It's a tool. It
is.
requires some training, and it's probably something. How about medical schools? Are they embracing this yet, or are they teaching this? When I don't know where you go to. I don't know where, for example, Dr. Pugash studied, but there must be some place you go to learn to be a urologist here.
So that takes it to the residency level after medical school. And once treatments like this become accepted at the university level, that's when you start teaching residents about it. So we have universities throughout the country now, from the East Coast in New York to several sites in the West Coast and many in between, that are now providing services like HIFU, and as a result, the residents are being exposed to this, and it gives people like me a chance to go there and help them understand how to use this a little bit better.
Well, hallelujah, because I'm of the age, I'm in my 60s here, and prostate, just as women fear breast cancer, men fear prostate cancer as we get older. And I'm sorry to say I probably don't have it tested often enough, because the alternative sounds so horrible and so awful. I somehow want to stick my head in the sand and say, I don't want to know. If I don't know, I can't be sick. That's not the correct way to approach life here. And if you made it as you have, not as frightening, not as fearful of the results, not as invasive, and much more focused, I breathe much easier and be much more willing to find out earlier what I've got and address it here.
Well, Paul, don't take this the wrong way, but I look forward to seeing you in the office.
Yeah, no, I think so. I appreciate it. Where do we go? How do they reach you? And how do they get more information? Let's start with the your clinic here locally. The make sure I get this right. What's the name of the clinic here again?
So there's a couple of great sites to go to. There's Western States with an S, HIFU, HIFU.com, which is very rich with content.
Okay.
From patient interviews.
That's what
and
we've learned
experiences.
about the process and the technology.
Yeah,
Right.
and just great patient comments, including a great focus group on guys who'd had the procedure and talked about it afterwards together. And also Pacific Coast Urology. .com has information about HIFU as well as many of the other services.
And that's
we
your
offer.
clinic where we can actually get this treatment.
Across the street, yeah, we do it at a surgery center.
Right, but through this facility. And
Yeah.
then if, I don't know, we're a business channel, we have lots of investors. I don't know if you're looking for next rounds of money or anything here, but if they want to know about the technology itself and this way that you're providing this service to other physicians, how do they learn about HIFU prostate services?
Well, you can go to our website, HIFU Prostate Services, or you can call us. We've got an 800 number if you find it on there. Call our office and just talk to us about it. We actually have nurses as well on a nursing line. So if somebody just has a clinical question and wants to understand, or maybe they're watching this or listening to this online in some other part of the country, they can call our 800 number and talk to a nurse, and they'll direct them to somebody local in their community. Or if they want to fly back home and see Dr. Pugash, they can do that too.
And again, all of these to me just overwhelm me. On one level, they sound so fantastic. It's hard to take it all in. But that's what technology does for us. And I'll give you a classic example. Both my father and my mother and my aunt all have passed away in their 90s a few years ago. But many years ago, my dad had his, what's the thing that, I can't even think of it now here. What's the thing that typically bursts and it doesn't have much function in your body here? Appendix. He had his appendix. I couldn't think of the word. He had his appendix out. Oh my goodness. It was just horrendous. It was like, invasive, and it took him forever to recover. And a couple of years ago, before she died, my aunt had it done, and they just stuck a needle in and blew it up and dissolved the thing. And it was an outpatient surgery. So what seemed horrible 20 years ago became almost minor and routine due to technology. It sounds like you're moving in that same direction.
We are, and I just want to mention one thing. When you asked how to contact us, and Ross mentioned the phone numbers, ours is 844-HIFU-DOC, D-O-C.
And HIFU is just like it sounds, H-I-F-U.
Just like the Japanese spell it, yes.
Okay, it's not a haiku, it's a HIFU here. All right, well, thank you for coming in. I applaud you for what you're doing. I welcome that there's a non-invasive, easier, less intrusive, less problematic way to deal with what we're all frightened about. And I hope that we all learn from that, and me included, go get yourself tested here and find out. There's no reason to avoid this anymore. Technology has taken us places that we couldn't imagine a couple years ago. All right, thanks so much for coming. You've heard another one here on Orange County's only community radio station, bringing you the most interesting stories right here in your own backyard. Right here in Orange County's only community radio station, OCTalkRadio.net.